Let's take another live look outside. Now that is what we're talking about. That's going to keep you cool today, this weekend, and by cooler, like today is 90 degrees. That's as cool as it's going to get. This weekend, we're going to see near triple-digit heat, and it's going to stick around for days. So Dr. Payal Kohli is here to help us through this heat wave. This is an obvious question, but we'll start with it. Why is heat so dangerous, and who's it most dangerous for?
You know, our bodies were not designed to be at high heat. And essentially what happens inside our bodies, we want to regulate the heat very closely for all of our organs, is that when it falls outside that range and the compensatory mechanisms that we have, which are largely sweating and a faster heart rate. So think about what happens when you exercise. Your heart rate increases to give off more heat, and you start to sweat to give off some of that heat, and then as it evaporates, it cools you. But when that fails, we start going into organ failure. And the three organs that we worry about the most, your heart, your lungs, and your kidneys. And essentially what you're having is not just an inflammatory response, but a thrombotic response, meaning you're making more risk of blood clots inside your blood vessels. So we're talking increased risk of heart attacks, of strokes, of kidney failure, obviously of respiratory disease, but even cardiac arrhythmias like electrical problems. So I really worry about certainly my patients that have cardiac issues, anyone who's taking medications like diuretics, which can dehydrate you, blood pressure medicines that a lot of our older patients are taking, but even our kids, our pets, our pregnant women, these are all people who can't regulate their heat in the same way.
Wow. Well, and then, you know, we often say, well, there's no humidity, it's a dry heat. It's like putting your head in a blow dryer, but the altitude is a factor, is it not?
Kim, it's a huge factor. So here already in Denver, hopefully most of us are acclimated, but when you think about going up to the mountains, for example, certainly Corey will tell you it's going to be cooler up in the mountains.
Yeah, so you're tempted to go high.
You are tempted to go high. In fact, I was thinking of going to the mountains this weekend, but essentially what's happening is you're taxing your cardiovascular system from the altitude, which means a faster heart rate and increased respiratory rate. Also at altitude, we don't cool ourselves. It's called convective cooling. The wind kind of blowing in our skin doesn't cool us in exactly the same way as it does at lower altitude. So putting all that together is really a compound risk when you're at high altitude, especially if you're not acclimated for heat illness and altitude illness coming together.
Well, let's talk about heat illness specifically. People will talk about heat stroke.
Yeah.
And they'll throw these terms out, and there are different definitions for them, but there's a spectrum of illnesses, right, caused by it?
There is, and I think most of us will have mild heat-related illness. I know I've had those before when it's been hot. Heat stroke is really the severe one, and stroke, we use that word to really trigger an alarm. We can talk about what to do if you find somebody in heat stroke, but most of us will have some degree of mild heat-related illness. So I want to talk about heat rash, which is you'll notice these small little pimples, redness or pimples in your armpits, in your groin. That comes directly from the heat, and it's a result of your body's reaction to that excess heat. You get swelling in the legs. That's called heat edema. This is something we often notice as well when we're out in the heat for a long time. We get cramps, not just in our muscles of our legs, but even in our abdomen. So if you're noticing a little more cramping, especially after you eat or such, that could be related to the heat. And then some people even have what's called heat syncope, where they might get dizzy, lightheaded, or feel like they're going to pass out. Because when you're out in the heat, your blood pressure goes down, your blood kind of pools in your legs, and that can set you up for that. And so that's kind of the mild. The moderate is the heat exhaustion, where we're starting to have some signs, our heart rate's faster, we're sweating, and then heat stroke is really that severe illness.
Yeah. So one of those things I always hear about, take a cool shower, take a lot of hydration, but who's most at risk? Older people, children?
It's our older people, Kim, and drink a lot of water, but drink a lot of electrolyte water. Because what are you losing? Sweat, which is sodium chloride, and you're replacing it just with regular water, so that can actually dilute out many of your electrolytes as well. So make sure you're drinking the electrolyte water. But the point I want to make is if you find an older person, and this is the weekend to check on your older parents, your older neighbors, anyone who lives alone especially, that transition from what I talked about, the mild illness to the very severe, can happen suddenly,
quickly,
can happen unexpectedly, and it can happen without the moderate illness. So without really that warning sign of the heat exhaustion, you can go straight to heat stroke. And essentially the way to tell if somebody's having a heat stroke is they're confused. They're slurring their words, their mental status is not there. Do not give them water when they're confused, because you could actually trigger pneumonia if they aspirate or choke.
Really?
Yes, and so within As soon as
That's a good
possible,
tip.
you call 911, and then you cool them as quickly as you can. If they're able to walk, you put them in a bathtub, fill the bathtub with ice cubes. That's called immersion cooling. If they're not able to walk, you start to put ice packs in their armpits and their groins, and you squirt them with cold water, put wet towels on them. And waiting for 911 to come is losing time, because every minute matters when somebody has a heat stroke.
Well, I want people to hear that again, just because they hear this information every year. You just said if someone is confused,
slurring their words, not acting normally. So it
don't
can
give
be
them water.
Do not give them water, because they're not having a mental status where they can do what's called protect their airway. So it could go down into the wrong tube, into their lungs. It could actually make things worse. The most important thing is cooling their temperature. Now, usually if you feel their skin or you check their temperature, it's over 104. That's when we start to see heat stroke. But in our older patients, this can happen at lower temperatures as well. So just check on your old people this weekend. Just make sure that you're being a good neighbor, a good child, what have you, and make sure that you check on your kids too, because they can't always verbalize what they're feeling.
No, and they might get tied up with fun and forget to tell anybody.
Or they might just be acting cranky. They may not want to eat their food. They may be having tantrums, irritable, acting out. These are all signs of heat exhaustion.
Be vigilant. All right, doctor, thanks so much.
Thank you.